Welcome back. We are almost a year, hard to believe it, into the pandemic. And with so much change and so much challenge, we've all had to deal with very different kinds and different amounts of stress. We asked why you're feeling stressed out right now, and you spoke up.
I am in New Brunswick and my partner is in Ontario. And with all the added restrictions, it's quite difficult to see each other.
Securing a job within the engineering field is adding to my stress, and I'm not feeling okay about it.
I'm a disabled essential worker, and I'm really concerned about the disabled and elderly community right now.
I suffered a panic attack and went to the ER. Now I'm taking pills, practicing meditation, doing online therapy, but I still feel very hopeless.
It's hard to even think of the future when the next month seems so up in the air right now.
Yeah, okay, boy. So what impact is all of that stress having on us, and what can we do about it? Well, joining me now, Dr. Balpawa, a physician at a women's clinic in Vancouver, also an author, and Dr. Peter Selby, a senior medical consultant at the Centre for Addiction and Mental Health in Toronto. Hello to the both of you. Dr. Selby, can I ask you first, what are you hearing from your patients? Maybe not about what's stressing them out, but how difficult it is to cope with that stress.
I think the biggest issue is isolation and feeling dislocated. We have a huge opioid overdose happening out in the community where people are not necessarily achieving or getting into treatment, and it's been hard for them to get to treatment. And on the other hand, we have people who've been in recovery and are relapsing because now they're in isolation and they have access, for example, to alcohol or their cigarettes or cannabis, and nothing else to do, no restraints on them. And so that's the range of things that people are finding. And of course, then the added stresses of loss, grief, loss of job, worry about finances, all of those additional stressors add to the risk of relapse. And again, then the services that they relied on are not necessarily available to them.
Right. Dr. Pawa, you specialize in women's health, where we know the stressors are different. What are your patients telling you?
Well, first of all, Andrew, most men and women are equipped to deal with acute stress. But now, as you know, going into the second year, this has become chronic stress. And chronic stress wreaks havoc in both men and women. But for women, there is a differential. Women are, I talk to women every day, and they say they're feeling this profound sense of grief, sadness of the life they knew. They feel uncertain about the future economically. I mean, if you look at the majority of the minimum wage earners are women. If you look at the fact that women do a big portion of the household chores with cooking and laundry and doing home care for the kids or elderly. So women are feeling the differential and the stress of panic, and stress shows up in women's body a little bit differently as well because of the menstrual cycle and how our hormones are very connected. So stress hormones wreak havoc with female reproductive hormones as well.
And that's something that sometimes does get lost in the conversation, right? That we think of stress as being a mental, a psychological, and emotional thing, but it's also, as you're pointing out, a very physical thing.
Yes, the psychological state of a human being is very intricately connected with the physical state. So if you look at the 75% of the physical symptoms that we see in a doctor's office can be attributed to excessive, prolonged stress hormones, that's an astonishing figure. And stress can show up in different ways, Andrew. So physically, people may not connect that their heartburn is related to stress, or their asthma attacks are increased because of stress, or their irritable bowel syndrome. So a lot of physical symptoms show up, but people don't make the connection often that it is due to stress.
Right. So the million-dollar question is what to do about it. Dr. Selby, I remember early on in the pandemic speaking with a pediatrician in a story about parenting, and she was telling me, I'll never forget this, nobody's perfect in a pandemic. And those words really stuck with me. I never forgot those. What is the takeaway that you would give folks who are listening right now who are dealing with stress?
So I say be kind to yourself and the others around you. And when people are having a bad day, you're having a bad day. And make sure you have your social circle around you, either electronically or otherwise. But make sure you take the time to be connected to others. Make sure you take time to take care of self, whether it's eating, sleeping, physical activity. And then pay attention. If it's crossing that threshold, the health system is actually open for those kinds of things. So if you are getting to the point of despondency or significant clinical depression or anxiety disorders, there is help out there, and either go via your family doctor or your emergency room and get the help that you need.
And Dr. Pawa, I want to hear from you as well on this. The best way to weather a storm that, as you reminded us, is a very long-lasting one.
We're in it for the long haul, and so we have to pace ourselves. And the people I see that are successful getting through the pandemic, they have maintained a routine. And it's really important to create a toolkit for yourself and say, well, what is working? Not what I can't do. I can't go to the gym. I can't do this. But what can you do? How can you show up differently? And being creative and working a little harder to find joy, to find meaning, to find gratitude, to find humor. But if your symptoms are severe and you have severe anxiety, severe depression, don't sit at home and suffer in silence.
I have to say, we could talk a lot longer about all of this, but I thank you for the time that you've given us tonight. Dr. Pawa, Dr. Selby, thank you so much.
Thank you.
Thank you. Thanks for doing this.